Good morning, everybody. Thank you so much for joining us. My name is Ellen Cartmel, and I am the manager of the Tobacco Prevention and Cessation Program at the Kentucky Department for Public Health. We are excited to see you this morning. I will be helping moderate today's webinar. I'm super excited that we are going to be learning from Kentucky Cancer Program West. You might hear me call them KCP, so if you hear that, that's what that means, Kentucky Cancer Program. And they're going to talk about outreach to the military and our veterans. Before we jump in, I do have a few housekeeping items. The first is that, as you all know, if you've been on these webinars before, everyone is muted today, but we definitely encourage you to enter any questions or remarks in the chat. Feel free to have a great conversation there. There's also a box that says Q&A, and if you enter questions there, I will be monitoring that, and we will make sure to have time at the end to ask those questions of our panelists and get answers to whatever's on your mind. This webinar is being recorded, and I will share a link to that recording with you all later this week. And I'll also be sharing a link toward the end of today's webinar where you can share your thoughts on how it went. So please fill that out so that we can make future webinars as excellent and helpful for you all as possible. So with that, we can move into why you all are here. With Veterans Day coming up in only a few weeks, yes, I cannot believe November is right around the corner. We felt that this would be a really great time to highlight all of the outreach work that's being done with our veterans around the state and also with our members of the armed forces at Fort Knox and Fort Campbell. So leading a lot of that work for us is Kentucky Cancer Program West, which is based out of the University of Louisville. Today, we're going to hear from Pam Temple and Jamie Knight. And I have bios from each of them. So Pam Temple is the Cancer Control Specialist for the Falls District for Kentucky Cancer Program at the University of Louisville. She has worked with KCP for over 30 years. She's trained in smoking cessation, including freedom from smoking, and she's a trained tobacco treatment specialist. She spent time working in primary care offices to train providers on lung cancer screening guidelines, smoking cessation tools, and other resources. She also manages the Brown Cancer Center mobile mammography community screenings to reach uninsured and hard to reach populations with mammograms in local neighborhoods in Louisville and the surrounding areas. So she covers the Falls District with early detection and prevention programs, screenings, and survivor programs. Pam is a graduate of the University of Kentucky with a bachelor's degree in communications and a minor in psychology. And then our other expert today is Jamie Knight. Jamie is the Kentucky Cancer Program's Regional Cancer Control Specialist for the Pennyroyal District. She joined KCP in March of last year. And prior to that, Jamie worked for the West Area Health Education Center, and those area health education centers, you might hear them called AHECs. And also she worked with Baptist Health Madisonville for 15 years with the two of those organizations. So her experience there included community health promotion, grants management, continuing education, and clinical education coordination. Jamie holds a Master's of Science in Organization Communication from Murray State, and like Pam, she is also trained in freedom from smoking. So I hope you all are as excited to hear from both of them as I am. And with that, I am going to turn my own camera off so that we can hear what they have to share. Thank you.
Thank you, Ellen. Okay, I'm going to pull up our PowerPoint. Pam, can you see that?
Yes, I can. We're good.
Okay. I'm going to let you get us started.
Okay. Well, as Ellen said, we are the Kentucky Cancer Program, sometimes known as KCP. We were created by the state legislature in 1982 and was established to reduce cancer incidence and mortality through education, research, and service programs. The program is administered through the University of Louisville Brown Cancer Center and the University of Kentucky, the Markey Cancer Center. And we have 14 offices serving all the 120 counties in the state. And each one of those offices are staffed by a cancer control specialist who coordinates cancer prevention, early detection programs, patient and family services, professional education and training. And we mobilize the communities through coalitions and partnerships to address local cancer problems. We're recognized nationally as a unique program that is state-funded, university-affiliated, and community-based. The partnership with Kentucky's 2 major academic institutions and university cancer centers enables KCP activities to be based on science, driven by the latest and most accurate cancer data, and to serve as a laboratory for a population-based research. We collaborate with local, state, national partners on signature initiatives and coalitions, such as projects as we're talking about here today. So the map that you're going to see here, it shows the way the state is divided up between the 2 regions. So in the east, which you can see all the names are highlighted in a bluish green, depending on your monitor. But that is the area that is administered by the Markey Cancer Center at UK. And all the names that are in the purple, those are on the western part of the state that's administered by the University of Louisville Brown Cancer Center. And you can find our website at www.kycancerprogram.org. And then that will lead you to this map, and you can click on and find the person in your area to find your local KCP coordinator. We invite you, if you've never looked at our website, to please do that. Click through it. There's many resources on there, including our Pathfinder, which is a directory to link Kentuckians with information and services for cancer prevention, screenings, tobacco cessation, services and resources for cancer patients. And so it's searchable by zip code or the county, and it also has all the local and state resources.
Okay, so we're going to start with a little backstory about tobacco use and the military. So as you know, cigarette smoking remains the leading cause of preventable disease and death in the U.S. You guys are very aware of this as you are out there leading the charge to reduce tobacco use in your communities. What you may be surprised to find, though, is that more veterans and active duty military personnel use tobacco than the average U.S. citizen. So according to the CDC in 2018, the national average tobacco use was 13.7%. Of course, Kentucky usage ranked higher at 23.6%, but use among military and veterans was about 29%. So this is a very high use population, one that has some unique challenges and one that's often overlooked in our outreach efforts. So also on this slide, you'll see the various types of tobacco use, and they're broken down. Of course, cigarettes remains highest at almost 22%. So looking a little bit further into their culture to try to understand why tobacco use is so high, we found that actually 33% of active duty military didn't actually smoke until after enlisting. And this kind of seems unlikely, as the servicemen and women need to be physically fit, but there are many underlying reasons why they either started to use tobacco or continued using tobacco once joining the military. So the U.S. military has a culture that's actually encouraged tobacco use, and that began decades ago. They had easy access to cheap products, and oftentimes cigarettes were just given to them. Tobacco use wasn't discouraged, and it was actually viewed as a coping mechanism for soldiers in the stressful lifestyle that they were living. Peer influence also played a big part in this, as the young men and women were away from home and they found themselves in a new place, and they were looking to bond with a new group of people. And then also, according to the Truth Initiative, research from industry documents revealed that big tobacco companies actually targeted youth, young servicemen and women, referencing that this group was considered high potential because they were less educated, they have limited job prospects, among other many traits. Too fast. So the CDC has a great campaign, and it's called Tips from Former Smokers. And we just wanted to highlight a couple of the stories today. So here is Mark's story.
I started smoking. I was about 18 years old. I was a young hard charger in the military. There was a time when you could smoke in basic training, and we'd all be in formation, and they'd tell you if you had cigarettes, if you wanted to take a smoke break, you could fall out and smoke. So rather than staying in formation at attention, we'd fall out and have our extra breaks. I thought about the future, but if anything bad was going to happen, it'd be down the road, and I just was always kind of living for today. I started having some symptoms, some constipation, and a little bit of trace bleeding. It got worse and worse. I didn't know until I was diagnosed with colon cancer that smoking was a contributing factor. I kind of suspected, and I remember distinctly laying on the body and looking at the live monitor during the exam. When you're staring face to face at a tumor and you know it's cancer, there's no denying what's going on. Everything it came to a grinding halt. You just can't deny it anymore. I mean, I literally looked at this tumor on the monitor and realized I have cancer. I could die. And I realized I had to quit, because all of the negative effects that people talk about that you think are never going to happen, like getting colorectal cancer, they happen. Trust me.
So KCP, we began a multifaceted professional education effort on behalf of the Kentucky Tobacco Prevention and Cessation Program, testing the military and veterans along with their families in July of 2020, right in the middle of COVID. So that really helped this program a lot. Discovery and outreach started with active military bases in Kentucky, as well as the VA hospitals. And it has since branched out to other military organizations that serve the veterans as well as active military families. Our outreach efforts continue to enhance opportunities for cessation and prevention in the military community. There were some overarching challenges that we encountered along the way. First, if you're familiar with the U.S. military at all, you already know that they have a very private, tight community that is difficult to connect with. The best way to begin is with any initiative is to find a common connection and someone that is trusted in the community that you can use as your champion, and that can also then put us in touch with another proper person. For example, Jamie Smith had a contact in the Chamber of Commerce, and they were able to put her in touch with someone on the base. And then the final connection was made from there. Be creative. You've got to think outside the box and really utilize connections that you have in your local communities. The U.S. military has made efforts in the past 10 years or so to reduce tobacco among active military and veterans. Therefore, they have many of their own resources, and they're really good for smoking cessation, and we can look at that a little bit later. But one interesting thing we did find is that many military do not feel comfortable using the government resources, as they don't want them to know more about them than they already do. For an example is the Quit line. They have a very similar resource, but some prefer to use our Quit line rather than the government one. So again, we go back to culture, and it hasn't really been discouraging of tobacco. Many veterans have private clubs, and they're still smoking inside. It's where they go when they gather. They have different programs, and they really don't have their own tobacco control policies in that area. So many of the veterans have been smoking for so long, and they weren't receptive to our messages, and some aren't. And then there's the red tape. We found that when you do finally establish a relationship and identify resources that are helpful and they want, there's so much red tape with the military and the government that it's hard to get in. For example, Fort Campbell, they were interested in working with us for us to provide them a smoke check. However, because it was considered a gift, it had to go through the legal department, which was a very lengthy process. But this is where the VA hospital was easier to work with. We offered it to them and they were very receptive, and we could get it to them right away. Some of our successes that we've had, along with challenges, is that KCP has provided many additional resources that they didn't know that were even available. We identified gaps in the outreach and tailored materials to meet those needs. Pictured here is a banner that we produced and that we actually took to the state fair. We've had it there for the last 2 years. We even put it next to the military exhibit this year. So it was right next to the VFW and retired military that were there working. We also made some tabletop of these banners I gave to VA Hospital, and so they can actually use it with some of their programs. Most importantly, we've laid the groundwork and established relationships for future initiatives within this community.
Okay, so now we're going to look at some of the resources that are out there for military and veterans as well. Starting with veterans, there's really a plethora of cessation resources available to them. The CDC has some great materials on their website. They've even worked to tailor resources for veterans broken down by branch of service. They have medical coverage through TRICARE, which covers tobacco cessation counseling and medication, both prescription and over the counter for them. And that's for those that are retired from the military. For those that did not retire from the military, they may still be eligible for medical coverage at the VA, and that includes tobacco cessation counseling and medication, and the services are offered via telehealth as well. And then one resource that is heavily promoted to veterans is what Pam was talking about, their version of the QUIT line, and it's 855-QUIT-VET. And it includes online support, phone coaching, text messaging, as well as an app. And then there's an online community on Facebook as well. And then looking at the DOD resources, like Pam said, there's many resources for active military. Most bases offer tobacco cessation to active service members and their family, and many locations have certified tobacco treatment specialists on site, so that's very helpful. And then there is You Can Quit Too. This is a Defense Department education campaign aligned to the Defense Health Agency for the U.S. military. It was originally launched in 2007, and it's for both military and their family members. And then Military One Source offers resources to help military families manage stress overall. So it's a really good website. It has many recommended wellness apps. It promotes overall healthy lifestyle, and coaches are available to help with tobacco cessation as well there. And then here's one more story we want to show from the CDC campaign again. This is Brian.
Jamie, we are not hearing him, which is so strange because it worked when we tested it 15 minutes ago. Oh, wait.
Okay, I muted myself and I didn't mute the video. So let me try it again.
I loved it. I enlisted in November 1970.
Yes, now we can hear it. So will you start it over real quick?
Military.
Yeah.
I met my future
sorry.
By the time I was 10 or 11, I was smoking probably close to a pack a day. Smoking had been ingrained into me. It was part of who I was. It seemed like it was smoking. Having a cigarette that was Brian. That was me. I hadn't really thought much about joining the military at a young age, but I loved it. I enlisted in November 1972. Within a year after I got in the military, I had met my future wife. We were very young, and we wanted to see the world. Travel all over Europe. We saw things, and we were able to experience stuff that most people would never have the opportunity to do. I was stationed in Germany until I had my heart attack when I was 35. So I went from being able to travel the world and see the world to confining my life either at home or going to doctors. That's all because of cigarettes. Well, I had the heart attack. I had the first defibrillator where they had to cut my chest open and put the patches on. Then I had a bypass operation. Then my lungs started going bad. Then I had to be on oxygen. Then I had stents put in. Then I had stents put in. I was in the hospital for months. I spent days in emergency rooms, hundreds of IVs. My poor wife having to sit down in emergency rooms for hours upon hours upon hours. My kids getting called up. Dad's in the hospital again. He might die. You got to come down. It was a lot. Every doctor along the way said, knock it off, stop smoking, had to stop smoking. Even to the time when I had my first run for a heart transplant. I had smoked, I don't know why I did it. And then the day I went to the doctors, they always draw your blood, and they gave me the pager. They said, okay, you're on the transplant list. That's the key to the hope for the future is you get the pager and okay, now I'm going to get a new heart and we'll be able to live. And that evening, the doctor called up and said, Brian, we found nicotine in your blood and you need to come back tomorrow and give me back the pager. I'm not listed anymore. That was crushing it for me, for my wife, for my kids. It was hard. And I screwed up. I screwed up bad. And I just screwed up bad.
So overall, our advice for efforts aimed at the military and the veterans would be similar advice that we'd give for any initiative. And now that you have a better understanding of this culture, one of the best things you can do, as I said earlier, is find a champion. And I really found that with the VA hospitals. They were very open to anything that we could bring them. With our programming collaboration, I was able to pay for the training for the CTTS for a person at VA as well as in Lexington, VA, so Louisville and Lexington. So you need to connect with a person in the organization that is excited about the project and that will work best to meet your needs. And Louisville VA definitely was. Next, meet them where they are. Organizations and groups will be different at different points with tobacco cessation efforts. They have different needs. Spend some time researching and working to identify how you can best help them. One good idea is to, again, identify a veteran, a local veteran that has been successful in quitting and highlight their story, maybe feature it in a campaign. This is a very impactful way to reach people. We know this and we've done it in many different ways, but really getting a veteran out there that can talk to other veterans and help open doors for you is a key to getting into the military and trying to help them with their stop smoking. So utilize existing relationships that you already have in your community and resources that are available. Collaborate and have your partnerships that are very helpful in these efforts. And hopefully through this, we've given you a small insight on the military culture and their tobacco use. This is a hard to reach high population, but it's very worthy. So a lot of tobacco users are hard to reach, but we find the military is even a little bit more difficult because they've been encouraged to smoke and they were given the cigarettes.
So here's our information. That's our emails and phone numbers. And then again, you can visit our website if you need to find the KCP coordinator in your area. We do cover all of the counties across the state. So I want to thank Ellen and Heather for this invitation, and we'll be happy to answer any questions that you may have.
Thank you so much. We really appreciate your sharing that. And I had actually never seen that whole video, the second one that you showed, and that is really, really powerful.
That one was very powerful. So it, because it related it to not only how it affected him, but his family. When he talked about his wife and his kids having to go through it with him, and then him messing up. That one's sad.
Well, if anybody has any questions, please feel free to put those in the chat or to put them in the Q&A, and we would be happy to address those. I'm so glad to hear about the successes that you had working with veterans organizations and specifically, and the outreach to veterans groups that you talked about at the beginning, and how that was kind of a struggle. I can definitely relate to. My hometown is still trying to pass comprehensive smoke-free policy, and one of the big sticking points for our local elected officials is they're like, we will not do this to the VFW. Like, these people served our country and we're not going to tell them that they can't smoke. And so that is a talking point that we really had to work around, and being able to talk about how the Department of Defense, said that nicotine addiction is a threat to national security, like a threat to preparedness, a threat to all of these things, was a help. And another thing that is really powerful that I've seen is pictures from inside the VFWs, and not just VFW, but also Moose Lodges, which are now 100% smoke-free internationally, but different organizations like that. If you ever see, the one I saw was from a VFW where they had taken the framed medals and things that they had on the walls, and they took them off, and there were, these big white spots where it looked like the walls had been yellow, but it was actually just the nicotine. And so when you took the decorations and the medals and the things that were there to honor people for their service, when you took those off the walls, you could see how the nicotine was affecting the building. And therefore, it has to be affecting all the people in the building. So the work that you all are doing is so important. And I'm so glad that you found really powerful allies in the VA facilities.
Ellen, I have a kind of a funny story about going to the VFWs. As you mentioned, I've been around for a really long time. So many, many years ago, I went to a VFW post to do a presentation. They wanted somebody to come and present on just cancer early detection and prevention. So I went and set up to do my presentation and everything. And the entire time I was presenting, they were smoking and drinking. And so I just did my presentation and I left. Well, I don't know if it's still this way, but they would get credits every time that they did some sort of cancer education, because at that time, that was kind of like their philanthropy. So they kept asking me to come back and do different presentations on skin cancer, on childhood, the Indian summer camp that was around, and all these different things. And I finally said, you know what? I will come back, but you all can't smoke while I'm doing my presentation. The very first thing I always say is, you can't smoke. You shouldn't smoke. That's one of the first things you can do to reduce your risk of getting cancer. So they said, okay, Pam, we promise we'll do this. So I get there and I start setting up and they're smoking. They introduce me and they stop smoking. And I give my presentation and nobody's smoking. Then as soon as I'm done and I'm cleaning up everything, they start smoking again. So that was really my first real taste with the military, and how much they depend on these cigarettes, even in a social setting. And like you talked about, Ellen, I could go into these halls and it was cloudy, and I got to wear, since they kept asking me back, I would wear clothes that I could easily throw in the laundry as soon as I got home because I didn't like the smell. But it was very, very difficult in trying to help them see that what they were doing was really damaging their body.
I was talking to one person in my community who, unfortunately, I could never get him to like say this on the camera or in an op-ed, but he was very concerned about secondhand smoke and I think had never smoked himself, but was a Marine Corps veteran. And he was like, I didn't like fight to save my country just so that I could get taken out by secondhand smoke or lung cancer. Like he was like, no, I'm not here for this. And I was like, will you tell your friends that? And he was like, no, I'm just not going to go to the places where they allow smoking. All right, we have a question in the chat, this is such a huge one. It says, how do you deal with attitudes of fatalism among active duty military who may perceive smoking or tobacco use as not a big deal compared to the risks of their current service?
That is a challenge. When you get into Fort Knox and Fort Campbell with the active military, that's one of the things that they, they're fighting for the country, they're doing other stuff, and they just don't see this as a risk. So until it hits closer to home, as we see with any smoker, they don't want to stop. And but the military, what we found is they're really offering a lot of incentives to try to help them stop smoking. And if you ever get an opportunity to see the resources that they have within the military, it's really good. But it's, again, just trying to get them to take advantage of that. And again, we kind of go back to they don't want other people within the military to know what they're doing. And so when they try to stop, they sometimes come outside the military to seek assistance. But again, then it's hard to find those people.
That's a really great question. And I think that there's really a level of selflessness, among people who are willing to risk everything, in order to serve their country and to protect their families. And that's part of why I think that second video from CDC was so powerful, as Jamie mentioned, talking about how he saw it affecting his wife, he saw it affecting his child. Not from the secondhand smoke perspective necessarily, although that is absolutely an issue, but just from her having to, see his pain and be so concerned about him. So that was very interesting. Are there other questions? Well, while you all stew and think about whether you have any other questions, I am going to put the link to evaluate today's webinar in the chat. So feel free to click on that. If you've evaluated one of our webinars before, it's really simple, just a couple short questions. And there's also an opportunity at the end of the survey where you can tell us what you might like to hear about in the future, what might be on your mind, what you think people need more information about. We are getting ready where our team is in the process of looking at who the presenters should be and what topics we should cover in 2023, because it's already almost 2023. So we're definitely looking at those suggestions. So that is in the chat. Please take a look at that and take a moment to share your thoughts. Speaking of upcoming webinars, our next webinar is going to be, I believe it's November 1st. It's the first Tuesday in November, as always, first Tuesday of the month at 9:30 Eastern time. And next month, we're going to hear from National Jewish Health, which is the provider of our Quit line, as many of you all know. So they manage Quit Now Kentucky and My Life, My Quit, 1-800-QUIT NOW, all of that, and help us get some of the really wonderful data that we have that we're able to share with you all as well. This is really, really exciting because we also have some new data that says that almost 90% of Kentucky adults who smoke say that they want to quit. It's something like 88.5%. So really close to 9 in 10 smokers say that they want to quit. And that's specific to Kentucky. So we're really excited about having that data and learning more from National Jewish about how we can support them. So the topic of next month's webinar will specifically be their new provider resource initiative that we partnered with them on earlier this year, and learning how we can work with healthcare providers to provide that full circle care for the many, many, many thousands of Kentuckians who do want to quit. So in addition to the evaluation link that I just put in the chat, now I am putting the link to register for next month's webinar. So please join us for that. And again, let us know what other thoughts you have. So it's not too late to ask any questions that you may have. But if I don't see anything in the next couple of seconds, I will let you all have 23 minutes back in your day. All right, and before I do that, I do want to say thank you so much to Gary Hall. Gary also always has such a great positive attitude, and for you, Jamie and Pam, he said, thank you for your efforts. We understand how this is a huge challenge to address. So yes, thank you so much for everything you do, including the information that you've shared with us today. As I'm sure you all can tell, Jamie and Pam are very passionate about this and would be happy to talk more with you. So if you have any ideas of groups that you might like to partner with relating to veterans and active duty military, let them know, let us know, and we would be happy to connect you with any insights that we have.
Absolutely. Thank you so much.